Welcome. Among the bones of the upper limb, let's first look at the clavicle. We will walk through the 3D model, focusing on the important surfaces and attachments. Let's start with the lateral end, the extremitas acromialis. This is the flatter, more delicate side of the clavicle, which curves slightly backward in space and articulates with the acromion of the scapula. Next, let's move toward the corpus claviculi, the shaft of the bone. The clavicle is S-shaped. The medial 2/3 are convex anteriorly, while the lateral third is concave anteriorly. On the superior surface, the facies superior, the bone is usually smooth, with hardly any structures visible. The characteristic impressions are found mainly on the inferior side. Now let's look at the medial end, the extremitas sternalis. This end is thicker and bulges forward. Here we find the articular surface for the sternum, the facies articularis sternalis, which is part of the sternoclavicular joint. Among the longitudinal borders, let's first take the anterior border, the margo anterior claviculi. Medially it is fuller and convex forward, laterally it is slimmer and tends to be concave forward. Turning the bone, the inferior surface, the facies inferior claviculi, is the working side, where the attachment structures are aligned. The posterior border, the margo posterior, outlines the opposite curve of the S-shape. Above again, the facies superior remains smooth, serving as a good landmark. Returning to the lateral end, here we find the facies articularis acromialis, which articulates with the acromion. On the inferior posterior part we can palpate the conoid tubercle, and more anteriorly and laterally runs the rough trapezoid line. These two features serve as the attachment of the coracoclavicular ligament's two parts, the conoid and trapezoid portions, which connect from the coracoid process of the scapula. In the middle of the inferior surface of the shaft runs a longitudinal groove, the sulcus musculi subclavii, the impression for the origin and insertion of the subclavius muscle. Medially, also on the inferior side, there is a rough, fingertip-sized impression, the impressio ligamenti costoclavicularis. This is where the costoclavicular ligament attaches, anchoring the clavicle securely to the upper part of the thorax at the first rib. Returning to the medial end again, here we again see the facies articularis sternalis, connecting the clavicle to the sternum. And finally, at the lateral inferior part, once more the linea trapezoidea, working together with the conoid tubercle, it suspends and reinforces the shoulder girdle. Orientation summary: the subclavius groove always runs on the inferior side. The medial end is thicker and bulges forward, while the lateral end is flatter and bulges backward. The conoid tubercle and trapezoid line are visible on the inferolateral region, and the costoclavicular impression lies medially on the underside. Based on these landmarks, you can confidently position and present the clavicle. Clinical note: the clavicle is frequently fractured, typically due to a fall on the outstretched arm or shoulder, most often at the junction of the middle and lateral third. During healing, the callus may rarely grow into the branches of the supraclavicular nerves, causing persistent pain in the ipsilateral side of the neck.